Hi, I'm Dr. Shilpa Bhat, practicing as a dermatologist in Bangalore. I would like to share some information regarding the commonest problem that most of the adolescents face, that is acne. So, acne is a common problem. During adolescence, we see another peak that is in the adulthood, that is females above 30 years of age. That is called adult acne or hormonal acne. So, basically, there are two broad groups. So, today I'll be sharing about the adolescent acne, but the tips to some extent is common for both the people, adolescent acne as well as adult acne or hormonal acne. So, this acne, we need to understand that these are the inflammatory lesions of the sebaceous glands. Sebaceous glands are basically the glands that are secreting oil in your skin. So, these glands, they start secreting more at times. That is when the hormones come up, that is during puberty. After that, again, as a adults, if there is a hormonal imbalance. So when these glands secrete more oil or sebum, it has to come out through the pores or the openings of the sebaceous glands. So when this gland opening gets blocked, so the sebum gets collected inside. Once it is collected inside, it's a good media for the bacteria or yeast to grow. So Pitrosporum is a fungus that grows. We call it Pitrosporum folliculitis. That is something similar to acne, but it's not acne. But again, acne, basically, Propionibacterium acnes, that is the microorganism that grows within the sebaceous glands. The other organisms like Staphylococcus, Streptococcus, all of them come as a secondary invaders. So we now understood what is acne. So when these acne forms, it is very common for everyone. So we need to follow certain do's and don'ts. Those are the precautions. So what these acne patients need to follow, apart from the treatment from a dermatologist, there are certain tips that I can give so that their acne becomes much more manageable. So number one, never pick your acne. So picking the acne, thinking that you will be able to remove those whiteheads and blackheads and all that, you're helping the acne forming bacteria and also the secondary invaders to enter into your skin. So by picking the acne, you will be increasing it, as well as it leads to formation of marks. So avoid picking your acne. Second thing is avoid application of oil to your scalp, and also avoid application of all kind of fairness creams, application of oily sunscreens, application of any oils on your face. So please avoid all these things that can clog your pores. The third thing is steaming. Again, steaming can, hydrate the pores more. Because of that, the pores can get clogged. So again, steaming is not good for acne. It can increase the acne. Again, dandruff care is so important. So again, one more don't is, don't allow the dandruff to accumulate on your scalp. So keep washing your scalp regularly, at least thrice or twice a week at least, so that your scalp is clean and free of dandruff. So the other part of the acne care is your diet. So junk food, consuming high glycemic index diet, that is consuming more sugary foods, leads to acne. This is proven beyond doubt now. So all those items which are sugary drinks, soft drinks, and then cakes and chocolates, all these you have to avoid. Along with that, avoid dairy products and milk products, because these milk products are supposed to be containing hormones, because the cows are fed with the hormones and that is secreted in the milk, and that can increase the acne. So avoid milk products and high glycemic diet, and make sure that you exercise well. You burn your calories. So important. If you put on weight, again the hormonal imbalance that it can lead, that can cause in further breakouts. Then, of late, during COVID times, nowadays we are seeing a special type of acne called mask acne. This mask acne happens especially when you wear mask for long hours of duration and you have acne prone skin. So follow these precautions. Simple precautions like applying a thin moisturizer, a oil control moisturizer preferably, a thin layer of it before you wear the mask. Avoid the sunscreen within the mask, and also, wear a mask which has a comfortable fitting. If your mask is too tight, or if your mask is causing irritation and pressing on certain areas of the skin, those are the areas where there will be occlusion and you start getting acne in those areas. So to avoid mask acne, hygiene of the mask is also important. If you're wearing a cloth mask, make sure that you wash your mask regularly and keep the mask cloth, very soft and thin. If you're wearing a cloth mask, if you're wearing a surgical mask, yes, make sure that you use it only one time. And wearing it for short times, avoid for prolonged usage of masks. That is also important if your profession permits. Of course, for doctors, we are helpless. We are supposed to use the mask for long hours every day. But then, yes, mask acne, if mask acne happens, then make sure that you treat the acne in a very gentle way. Use a gentle skin cleanser. Cleansers are so important in taking care of acne. So what kind of cleanser you are supposed to use? A cleanser that will not irritate your skin, that will not dry up your skin. Again, so here, depending on your skin type, your dermatologist will be able to suggest the face washes. So commonly, when the skin is dry, this is a common note, it's not for everyone. When you have a dry skin, we suggest cleanser. When you have an oily skin, we generally suggest a foaming face wash or a face wash containing salicylic acid or a glycolic acid, these kind of face washes. So these are the tips, simple tips for taking care of acne. So washing your face with a good cleanser with 3 to 4 times a day is so important. So washing the face, washing the scalp regularly, and avoid picking, and making sure that you wear the right kind of mask. These are the simple tips to take care of acne. I hope my tips help you all. Okay, take care. Bye. Thanks for watching.